Definition: dysphagia lusoria is an abnormal condition characterized by difficulty in swallowing caused by a aberrant right supply artery.
Dysphagia refers to a characterized by difficulty swallowing. There are two main classes of problems that can lead to swallowing disorders. Neuromuscular problems. Muscular disorders that affect skeletal muscles such as muscular dystrophy or myasthenia. Diseases of the nervous system that compromise the way the brain reflex, such as disease or multiple sclerosis. Weakened muscles and/or impaired coordination as a result of aging. Two phases of swallowing. Narrowing of the throat or esophagus due to throat cancer, esophageal cancer, and formation of small sacs or rings in the gastroesophageal reflux disease, GERD, is also a common cause. In GERD, scars resulting from obstruct the swallowing. This class mostly affects the third phase of people with dysphagia may be serious. Someone who cannot swallow safely is at high risk of choking, pulmonary aspiration, and may not be able to eat enough to stay healthy. Treatment depends. Muscle exercises may be recommended for some. A change in the position of the head and neck when eating could be beneficial to others. Right choice of food and drink is important for most. Soft, textured food and thickened drinks are recommended for safe swallowing. Surgery may be needed to remove narrowed parts of the esophagus. Finally, patients with severe dysphagia and recurrent aspiration may have to resort to tube feeding to get nutrition to the body.
Application in medicine. The diagnosis of dysphagia lusoria is always difficult and late as the symptoms are often non-specific, and in the same time, diagnostic endoscopy is negative in more than 50% cases, and nanometry has no diagnostic role. Radiograph features. In this, we can find plain radiograph, fluoroscopy, computer tomography scan, and magnetic resonance imaging scan. In plain radiographs, just the radiograph can demonstrate enlargement of the superior mediastinum. Fluoroscopy. Various studies of the esophagus may show the indentation of the posterior esophageal wall by the artery. Computer tomography scan and magnetic resonance imaging scan, the CT angiography, and MRI thorax are the best diagnostic modalities that could identify the arterial lusoria. Issue applied in Ecuador. The percent of the aberrant supply artery is a rare clinical entity in the general population. However, it is the most common anatomic anomaly of the aortic arch, with an incidence of 0.5 to 1%.
People in many different ways. For some, the difficulty is in swallowing solids, particularly bread and meat. Before the food feels as though it has gone down completely. For others, swallowing liquids may be problematic. People with dysphagia may regurgitate food through the mouth or the nose. Food or liquid can be inhaled or aspirated into the windpipe and lungs. Aspirating food can lead to lung damage. Some people experience chest pain when they eat, which can be due to spasms of the esophagus. It is often described as a squeezing pain under the breastbone. This pain can be similar to coronary artery disease. The two could be confused. Weight loss that can be experienced by people with dysphagia, which should be attained through careful planning and food preparation with the support of a dietitian. dysphagia, any condition that weakens or damages the swallowing, for example, cerebral palsy or Parkinson's disease, often have swallowing difficulties. A strong sensation in them. People born with abnormalities of the swallowing normally have conditions which can MS, myasthenia gravis, a form of muscle drugs which can lead to, for example, phenylphthalein drug, which affect the throat muscles. Dysphagia can usually be classified as one of pharyngeal dysphagia and esophageal dysphagia. The former is the more common type. Patients with oropharyngeal dysphagia have difficulty in initiating swallowing, but they also have associated coughing, choking, or nasal regurgitation. The patient's speech quality may have a nasal tone. These dysphasias are most often associated with stroke, Parkinson's disease, or other long-term neuromuscular disorders. People with esophageal dysphagia experience the sensation of food sticking in their throat or chest. The patient's description of the perceived location does not match the actual location, especially if the perceived location is in the cervical area. Motility disorders and mechanical obstructions are common. People with neuromuscular dysphagia experience gradually progressive difficulty in swallowing solid food and liquids. Cold foods often aggravate the problem. They may eventually succeed in ingesting the food by repeated swallowing or by changing their position.
Conclusion. Even though dysphagia lusoria is a low-frequency pathological entity, it is important to know this anatomical variant in order to make a right differential diagnosis. Thank you.